And again, thank you. Good afternoon, everyone. Welcome to School-Based STD Screening Efforts in Miami-Dade County, Florida. NCSD's webinar highlighting the screening efforts as a result of the spring 2008 1 in 4 teenage females in this country having an STD, that data point, and the subsequent results of that data point in Miami-Dade County. Again, my name is Sandra Sedna-Smith. I am the Program Manager in charge of Adolescent Initiatives at the National Coalition of STD Directors, also known as NCSD. As part of our adolescent health work, we receive funding from CDC Division of Adolescent and School Health to provide resources, support, technical assistance to state health and education agency officials to implement effective STD, HIV, and teen pregnancy prevention strategies and initiatives. So this webinar is one part of our offerings. This webinar is actually follow-up to a series that we held last September 2010, on school-based screening programs featuring the state of Louisiana, Michigan, and as well as the District of Columbia. And I have to thank you all on the phone because through feedback we received from those webinars, we found that a lot of you wanted additional information on programs, or rather on screening events that were not full-scale programs that were just starting out or possibly serving rural populations. And so we were delighted when our colleagues at Miami-Dade County Health Department and Public Schools, County Public Schools, said that they would be willing to share the wonderful information in the school-based screening efforts that they have been conducting. And so I just want to say that obviously we could not have produced these webinars without support from CDC-. So I'd like to thank them. I also want to make note that all of the content you're going to hear today is solely the responsibility of NCSD and does not necessarily represent the official views of the Centers for Disease Control and Prevention. So just to make sure we're all acclimated to the technology, I just want to go over a couple of things. Obviously, as you know, you joined a very silent call because currently the phone lines are muted. In order to submit questions, go ahead and use the chat box on the left side of your screen. You can ask a question anytime. I will personally be keeping track of the questions to read out to the presenters during a designated Q&A session that we hope to have during the final 20 to 30 minutes of this presentation. In addition, this webinar is being recorded, and a link to the archived recording with all the slides will be sent to anyone who registered for this webinar. So whether you are currently on the phone or you have colleagues who signed up and were unable to attend this afternoon, we will be distributing the webinar link to them. I plan to do that within 1 week of today. And eventually, whenever NCSD's new website is launched, we will post this webinar along with any other webinars we've done on STD school-based screenings. So I would like to start off by introducing our presenters for today. Alessandria Killingsworth is a CDC Public Health Advisor assigned to the Miami-Dade County Health Department's Sexually Transmitted Disease Prevention and Control Program. As Operations Manager, she provides administrative support and program management to teams responsible for disease intervention efforts among clients in STD clinics, jails, prisons, schools, institutions of higher learning, and the community at large. Throughout 20-plus years, Alessandria has worked with health departments in Atlanta, Charlotte, Fort Lauderdale, New Orleans, and currently in Miami in the capacity of Disease Intervention Specialist, HIV Counselor, Special Projects Coordinator, Corrections Liaison, Surveillance Supervisor, and Field Operations Manager. She participated in the syphilis outbreak response efforts in Augusta, Georgia, and Baltimore, Maryland, and worked during the Hurricane Katrina recovery effort in the Gulf Coast and CDC EOC novel influenza, the H1N1 response. Additionally, we have Jacqueline White presenting with us. Jacqueline is the District Supervisor for Health Education for Miami-Dade County Public Schools. During the time of this initiative, her title was District Supervisor for AIDS Education, where she was responsible for administering the CDC-funded cooperative agreement, improving the health, education, and well-being of young people through coordinated school health program. As the program administrator, Jackie was responsible for staff professional development with regards to HIV, STD, sexuality, curriculum implementation, directing school site HIV/AIDS programs, as well as working collaboratively with the local health department and community-based organizations to support the goals and objectives of the school district's HIV/AIDS education program. Additionally, Jackie has coordinated Miami-Dade County Public Schools' Safe and Drug-Free School Substance Abuse Prevention Program, served as the Program Director for School-Based Prevention for the Economic Opportunity Family Health Center, which is a federally qualified community health center, served as Interim Clinic Substance Abuse Director for the Everglades Correctional Facility, was a recipient of the Manpower Access to Community Health, also known as MATCH, Fellowship, as well as an adjunct professor at Florida International University's School of Public Health. And last but not least, we have Joyce Brislon. Joyce is a health science instructor at Miami Palmetto Senior High School. As a health science instructor, she teaches health science and dental aid to 175 Miami-Dade County Public School high school students and is the advisor sponsor to the HIV Peer Educator Club, the Gay Straight Alliance Club, and the Health Occupation Students of America Club. Joyce has a bachelor's degree in labor education, certification in dental assisting, phlebotomy, medical administration assisting, and sexuality education. After hearing from our wonderful speakers, we hope that you will be able to name key strategies for leveraging existing partnerships to create school-based screening events. You will be able to describe how to cultivate both teacher and student leadership in supporting screening efforts. And finally, you will be able to discuss the benefits of establishing community processes to address public health issues. And as I mentioned before, we will have a designated question and answer session. And at that time, we'll use the chat box depending on how many people we have participating. Right now, I see we have over 50 folks on the line. We may be able to unmute all the lines and have you ask Q&A in real time, not using the chat box. So before I hand it over to our presenters, we have a poll for you to complete. We're going to give you around 45 seconds to answer the poll. The question is, are students in your community screened for STDs at schools? You may answer yes, at a clinic on school grounds, yes, by the health department, no, but referred to an off-site clinic, no, and there is no referral system, I don't know. So feel free to go ahead and take a few seconds to answer that question. We just want to get a sense of who's on the line. And I see some of you are answering in the chat box. You should be able to select an answer through the actual webinar. And if not, I apologize if that technology is not working. Right now, I only have 4 people who have responded. Okay, I see people said they can't choose from the screen. That is really unfortunate. Let me see what I can do. Okay, no option to select. I can only respond via chat. Okay. All right. There's a lot of variations in answers. Thank you. I'm sorry that the poll option for this particular question did not work at this time. I see some variation in terms of yes by the health department, a couple of no's with no referral system, but referred to an off-site clinic. So there's lots of variation. It seems like we have a really good mix. And again, I apologize that the poll did not work. So given that we have such variance, I'm going to go ahead and hand it over to my co-presenter. Alessandra, if you're ready, you can go ahead and jump on.
Certainly. Thank you, Sandra. First of all, we would like to thank everyone in the listening audience. Thank you very much for joining in today to hear more about Be Sure, a school-based demonstration project held in Miami-Dade a few years ago. As you know, a demonstration project, by the very definition, provides a structure for testing and introducing beneficial change in a system by testing new ideas that will shape the future of projects and address system needs and problems. Having said that, with this in mind, today we will be thrilled to share with you how the Miami-Dade team had one mission to provide education and screening for chlamydia and gonorrhea in 2 days at 2 local senior high schools, and how by working together we were able to recognize a mission accomplished. Be Sure, again, is a Miami, Florida-based demonstration project initiated in response to the CDC Study 1 and 4. In March of '08, on the heels of the National STD Prevention Conference, the CDC estimated that 1 in 4 young women between the ages of 14 and 19 in the United States are infected with at least one or more of the most commonly sexually transmitted diseases. Well, involved in testing, this testing process was equivalent to what we would call an idea that generated as a result, as mentioned, 1 in 4, as we see as something being very, very serious for not only teens, but the teens who ultimately will grow into adults. Getting started, the Miami-Dade County Health Department presented the idea. I, as a representative for the STD program, had a conversation with my boss, the STD program director. Next, I contacted the Miami-Dade County Public School District Office to present this idea. We met 1 week later to review school policy, clarify goals and objectives, and to identify collective resources. And we agreed to having urine-based aptima for gonorrhea and chlamydia as the IDEA project screening tool because it's non-invasive, quick. It's something that we thought the school district would accept as being an initiative and a pilot within the school system for the very first time. So next, the Miami-Dade County Health Department and Miami-Dade County Public School District Office began planning its next steps. A huge next step, getting buy-in. From our perspective at the Health Department, the next step in getting buy-in was presenting the proposal to the STD program director. Totally different than the earlier slide where we presented the idea. So in presenting this proposal, I shared with the program director the response to the CDC's 1 and 4. I described that this was a further opportunity for us to gain the pulse on what was taking place with students in our local community, as well as understanding what their needs as it relates to STD care was. I described it as being a landmark initiative for the local community, as well as an opportunity for multi-agency and program collaboration. Next, I developed a preliminary plan, which included identifying funding, which is huge for all of us at this time. And next, the STD program director gave me permission to talk with his peers, and these are the other senior leaders of the Miami-Dade County Health Department's programs. And the senior leaders came through. They assigned to participate in this demonstration project numerous staff that you will hear about in a few more slides.
Good afternoon. When Alexandria presented this idea to me, we had to look at the structure of our school district. We have a centralized district office that basically serves as the gatekeeper to the schools. We're responsible for ensuring the validity of our partners, identifying curriculum, directing curriculum, professional development, and so forth. So I had to galvanize the support of our governing district offices, and those were student services, legal, as well as health education, to support this idea. I met with district administrators to present our plan. I validated the credibility of all partners. That included the lab. Of course, we know the health department is a credible entity, but we had a number of local supporting agencies that participated with us, and we wanted to make sure they were all valid and credible, as well as the fact that they were able to come onto school property, because in Florida we have a Jessica Lunsford Act, which governs who has access to students. So we had to make sure we covered all of our governing laws and procedures and practices. What we found was there were no policies that directly prohibited testing on the school site. However, the issue became a liability issue once we identified a student that may have been positive for an STD. What is the school's or the district's liability in, one, notifying that student as well as providing treatment? In the absence of any specific policies, the onus became on the school site administrator. We also tried to identify schools. We wanted schools that both had a need but would be a successful venture, because we knew that this was going to be a demonstration project. We identified two schools, Palmetto Senior High School and Southridge Senior High School. The demographics were a little different between the two. Palmetto is in a more affluent neighborhood, and it's designated as an A school through the state of Florida grading system, and Southridge is less socioeconomically affluent, and it was designated as a D school. The other concern was the presentations, the health education presentations, and we made sure that the health education presentation was aligned with the existing district-developed health education curriculum regarding human sexuality, or we call it human growth and development. And it was also, that curriculum is in line with the state health education standards. So at this point, we have a slide, and I'm hoping you all will be able to work this slide. And it is, do you have any policies that allow for STD screenings on school grounds in your jurisdiction? So please take a moment to complete this survey.
Great, we see that it's working.
No. Yeah. We're going to give you all a moment. Okay. We'll go on to Barbara. Joyce, I'm so sorry.
It's okay. Good afternoon. The next slide that we're going to be talking about is getting buy-in with the schools. After Ms. White introduced the project idea to me, I presented the idea to my school principal. I showed him the data from the CDC 1 and 4, described the offer to participate as presented by the Miami-Dade County Public School District Office. I communicated the implementation plan. We recognized the potential to help the students and the community. It was a great opportunity to collaborate with partners in the public health. And then we had to sit down and develop the preliminary plan. We had to assess the need for parental permission for the STD screenings. We identified students participating from the anatomy and science classes. We had to secure the area. We had to secure the library, the gymnasium, and the basketball court where the screening could take place. It had to be accessible to the restrooms and convenient to the students' common area. We met with the health department and the district office to finalize the plans, and we created an in-school field trip form for the HIV peer educators so they could get parental permission to help facilitate the project. And the peer educators, the HIV peer educators that we have, were totally on board. They're the ones that sold the project to the peers. They did a great job. They were excited about getting the school tested. They created a school-wide campaign to say it was cool to get tested and to know your status. They emphasized the testing was voluntary and confidential, and they promoted testing as a quick and convenient way to know your status. It was urine-based 2 for 1. What a deal. Okay.
We're taking a moment to reply to a quick chat. Okay.
There were several salient fundamental questions that we had to address in implementing this project. They were, what are the governing laws, policies, and practices? Who has vested interest in the outcomes, that is identifying our stakeholders? What are the issues and how are we able to make an impact? So we had to sit down and brainstorm, the three of us, as to what were the possible impediments and what were the possible benefits of having this initiative. What type and amount of resources are needed and available, whether parent consent is needed. We had to look at the legal issues, what services available to students on and off campus, and how many participants can be serviced during an event period, and what services will be offered and to whom. So we got started. The Miami-Dade County Public Schools District Office identified several senior high schools known for having progressive health education programs and invited their participation. The health department representative as well as the district office representative conducted site visits. We met with the designated school site administrators, teachers, as well as paraeducators. And then we looked at the school grounds and the surrounding areas for possible locations for the school bands, whether there were access to restrooms, and how the flow would go on the day of implementation.
Okay. The next couple of slides will illustrate the number of gonorrhea and chlamydia cases from 2005 to 2007 in Miami-Dade County. Here you will note a huge increase in the number of chlamydia cases among males from 2005 to 2007, and a small, however, an increase in 05 and 06 among females, and a marginal change from 06 to 07. Here you will notice the sharp increase of gonorrhea cases among males from 05 to 06, with a leveling off from 06 to 07, and the gradual yet steady increase among females from 05 to 07. Again, 2 schools, 2 days. This demonstration project at both schools mostly mirrored each other as it relates to the content. At both schools, STD 101 presentations, and shall I say tailored to senior high school students, were presented. I believe there were 4 presentations at School 1, and during this presentation, in addition to the STD 101, we showed the 1 in 4 DVD from CDC with Dr. Kevin Fenton, then the STD 101 presentation, including My Story, which was delivered by a young woman living with AIDS. There was a Q&A session as well as a survey. And STD screening was done on site, and there was a mobile van on site for the lab processors. And the difference between School 1 and School 2, there was not an opportunity to conduct a survey on that day based on logistics, and the park station was used for the lab processing. Screening and results. There are a total of 1,020 students who volunteered for screening, and we identified a total of 85 new STDs. Overall, between both schools, the overall positivity for both diseases was 8%. Disease intervention, intervening in disease, that's what we do so critically day in and day out within the Miami-Dade STD program. 76% of the 85 new STD diagnoses were treated, which is an 89% treatment rate. 94% were treated at the West Buyin STD clinic, and the staff did a tremendous job in providing support to each other to ensure that students were not only notified, but once they made it to the West Buyin clinic, that they were seen, given priority. Not only were they treated for the identified STD, but they were provided an opportunity to have other clinical services. And as we know, STD programs and disease intervention specialists, as well as the clinicians and persons providing support services, do a tremendous job day in and day out. One thing that I want to note that's really important in even developing and designing this demonstration project was, as Jackie mentioned earlier, making sure that we were dotting our I's and crossing our T's as it relates to not only the initiative to present information, educate students, bring about awareness, but especially what would we do if we found a positive? We all know that STD programs are based on surveillance, having field operations, and I mentioned disease intervention specialist components, but when you start talking about introducing 85 new treatment opportunities into a small yet healthy STD clinic serving as a satellite for the southern community, and trying to do this, get students in and have them treated not only timely but appropriately is a big deal. So in this, we took a look at the STD program was approximately, our STD clinic located at West Buyin was approximately 6 miles from School 1 and 3 miles from School 2. The others were treated at a private medical doctor or either at out of jurisdiction or another county in Miami-Dade in Florida. We did have one refusal, person who was notified. However, as far as we know, we're not sure whether or not they followed up and received treatment. And we had 9 persons who were unable to locate, or as far as we are aware, some may have gotten treatment, and there's evidence that there may have been a couple of people who delayed treatment for a significant period of time, which may have resulted in some complications and consequences from not being treated early. Be sure, this is how 1 plus 2 plus 2 plus 2 equals 1,020. 1,020 students voluntarily participated in the chlamydia and gonorrhea screening at the two local senior high schools in 2 days. 1,869 students participated in the STD 101 1-hour presentation, including hearing the testimony of persons living with AIDS. We were able to conduct a short survey and get valuable information and feedback from the students' perspective. Students received test results by telephone, and again, this is a kudos out to the West Perrine Clinic team who fielded the phone calls, and the students had to have a unique password at the time of testing. Students with positive test results were contacted by the STD program disease intervention specialist. They were informed of their results and locations to access free treatment and additional STD diagnostic services, as I mentioned earlier. And they were also provided an opportunity to help us understand where their infection came from and who they possibly spread it to by participating in partner services, and STD prevention counseling was provided. So what the students were saying, it was the self-administered survey that we gave the students after their STD 101 presentation. We asked them what they thought was most valuable about the presentation. They thought the guest speakers were valuable. They said everything was valuable. The statistics were important. The pictures were definitely important, and the symptoms. We asked what health information would they like to hear in future presentations. The students were saying they wanted to hear more information on HIV and AIDS, the treatments, more about the diseases, some new information, and safe sex statistics. We asked them where do they get most of their information on sexual health from? Was it the TV, their friends, the internet, or their parents? And we asked them what's the best way to get sexual health information to you or to your friends? And we asked them if it was the internet, the school, a presentation like they just sat through, the health clinic or a doctor, a talk or their parents, a presentation, a teacher, a doctor, a health class, speakers, or a clinic, the health department, or others. Protecting our future. This was an example of a multi-agency and program collaboration. With this help, it created a blueprint for our efforts to develop ways to reach adolescents. The results have helped the Miami-Dade community better identify opportunities for preventing STDs and HIV among young people by providing an accurate depiction of the disease burden among adolescent females and males, and allowing for the development of proper responsiveness and interventions. Since 2008, we have implemented STD education curriculum and screening at the Department of Juvenile Justice. We've conducted STD 101 training for Miami-Dade County public school teachers responsible for curriculum implementation. We've also encouraged student participation, and April is STD Awareness Month. We've provided STD education and screenings at schools for pregnant teens. Additionally, we've utilized Miami-Dade County Public School District Office as a resource for the health department in locating students. We've worked with the University of Miami's Connect to Protect Coalition, C2P, to identify structural change objectives to expand STD HIV services. And we've also increased the number of schools participating in the STD HIV screenings conducted through the Miami-Dade County Health Department office, initiatives such as Take Control and Test Miami. We've had a number of invaluable lessons learned. One of the great lessons learned from this demonstration project was how to successfully develop a formula to adequately staff an event. We also learned it's important to schedule staff breaks in advance. At this particular School 1 event, we had such an overwhelming response. Students were certainly, Ms. Brislund, they were given permission, those students who had taken part in the STD 101 presentation, they were given physical passes to excuse them if they were late for their next class, those who wanted to participate in screening. We literally left the first presentation, walked outdoors to the screening area, and there was a line wrapped around leading into the basketball court. We had to make decisions on the spot at that time as to what we were going to do. Certainly we felt that we were adequately staffed because we had, I believe, approximately 20 persons from our staff combined as a team at School 1, and the second school we staffed with approximately 22. However, at mentioning School 1, the demand was very, very great. It surprised us and gave us a huge lesson learned in terms of not only adequately staffing, but also staffing where staff can not only provide the services to the students, but they can take breaks because they ended up being pretty exhausted, not only after day 1, but day 2 as well. Another lesson learned was we need to make sure that if we can access mobile labware to have on site, to enter the lab data into the computer where that lab data can easily be transmitted into the mainframe of laboratory services office. That would assist tremendously in not having to duplicate entering labs into 2 different systems. On site, we simply decided to keep track of the number of students being tested and the QA portion by entering their information onto a register. However, we then had to take that information from the register and duplicate it for lab services, and they in turn had to duplicate by physically entering the student information into their labware. So if you have access to mobile labware, please use it. Another lesson learned was, as you heard earlier, the West Perrine Clinic team did an outstanding job in answering the phone to provide the results to students. Well, we're coming of age now. It's really important to utilize STD results via text messaging. We know that's how students communicate. And explore STD treatment on site if possible, and you'll have to look at your own respective policies to determine how that works within your state and your jurisdiction. And I see a number of questions coming in. We have just a few more slides, and we'll be able to just have a conversation after that. So the slide that you're looking at now is an event checklist. We recommend a checklist to include at a minimum of these items. Share the checklist with everybody who's involved in advance to keep everybody on track. Of course, there will be things that you'll discover while on site or afterwards, and you can simply add those to your checklist to make sure that the next event will go off just as smoothly. So just to list a few of these items, having the event name and purpose in writing on the checklist is key. Again, within 1 week period, we're at 2 different events, and just keeping people on track of where they needed to be, to include the address and phone number of the event location, the start and end times, and there may be various start and end times, the setup time, activity location time, where to park, what to wear, what not to wear, as well as what services are being offered, and making sure that you have, as part of your team, leads. Make sure that persons in advance know what their roles are, especially if you're bringing together multiple people from multiple programs and multiple agencies. And it would not hurt to have in writing what their roles or duties are, especially if they're not 100% familiar or have not participated in this type of event before. Some of the positions within the team were the presenters, registration. We had spotters, and in essence, spotters act as not only guides and tours for the students to make sure that they're in the right place, or that they know that they need to, for example, take the specimen into a certain area, or the specimen should be collected in a certain manner. But they were able to, on the spot, give us feedback as to the crowd control and other things that were important to making the event successful. Lab processors were a key role, the data entry as mentioned earlier, and as Ms. Brislon mentioned, the HIV peer educators were tremendous in getting buy-in. Make sure key activities and owners are designated in advance, so when you show up to the event, you'll have everything that you need. The laboratory courier, as you would know, is especially important to make sure that those valuable specimens reach their target area at an appropriate time, as well as secured. Lunch, as I mentioned before, having demobilization, making sure that you leave the property just as better than you found it, if you will. Having a post-event conversation with the team to make sure that you can learn, again, the lessons learned and best practices. So we are at a point now where we would like for you to share a bit more information with us. We'd like to ask you the third and final poll question. How would you rate the relationship between the health department and the school district in your jurisdiction? And as you see, the answers are, or response, are very good, good, fair, non-existent, or I don't know. So we'll give you a moment to participate in this poll question. Wow, this is really great. Very good and good are totaling 60%. Okay, we're going to move on to the next slide. which is an opportunity to just share, again, this has been a great example of teamwork and how multiple agencies and programs can come together to accomplish goals. The participants, as you see, included the Miami-Dade County Public Schools District Office, the Palmetto Senior High School, Southridge Senior High School, various programs within the Miami-Dade County Public Health Department, to include the STD program, the Office of HIV/AIDS, School Health Program, the Tuberculosis Control Program, Women's Health Program, and Laboratory Services Program. And tremendous thanks to the Miami Bureau of Labs for processing the 1,022 specimens with relative short turnaround time. To wrap up, here are a few extra helpful tips. Don't be afraid to identify your stakeholders and ask them for support. Utilize existing available resources, such as we did within the health department. Many of these programs have a vested interest. Seek expertise and train others. Match skills and build capacity. Tailor STD presentation to the audience. Teams have their own vibe. Give students written instructions on when and how to get results. They'll probably call anyway outside of those hours, but still, giving them something in writing is key. Inform students of partner services. Their partner may not be a student. Inform laboratory of your plan. They'll provide results turnaround time for you, so you'll be able to provide the students with the turnaround information or when to call for their results, or hopefully text message for their results. Explain confidentiality and the process to all involved. This builds confidence. Have a contingency plan just in case something breaks. Evaluate outcomes now and later. Realize impact and needs. And make sure you communicate successes. Share your story so others may replicate your success. And this is hopefully what we have done today in sharing our story, communicating success, but also, too, we recognize that there is a lot more work to be done. Thank you for your time.
Thank you, Alessandria and Joyce and Jackie, for sharing your information. I think you guys did a great job in the level of detail in terms of step-by-step process. I hope it was really helpful to all our participants. So we actually, and kudos to you as well for leaving us with ample time for questions and answers. In the past, we've not been able to have as much time for interaction, and I think this is fantastic. So thank you guys so much. So those of you on the line, as we promised, we're going to go ahead and go through the questions that were submitted in chat first, and then I will go ahead and unmute everyone's lines. When I do that, we will ask you to manually mute if you're not asking a question, just to eliminate feedback. But we'll go ahead and start asking the questions that showed up on the chat box. So I know one of the questions initially had to do real quickly with the second poll that we took. People were curious about numbers in terms of how many people responded. So we had 42 responses, and it looks like just under half of you do not have policies that allow for STD screenings on school grounds in your jurisdiction. So someone just wanted to get some information on the poll. The other question is in reference to the chlamydia and gonorrhea cases on slides number 22 and 23. that question was, are these cases based on the screenings?
No, those cases are not based on the screening. Those slides illustrate the 2005 to 2007 morbidity for chlamydia and gonorrhea in Miami-Dade County. And the Be Sure demonstration project took place in May of 2008. So those 85 new STD diagnoses from May of 2008 would thus be reported in latter morbidity or latter morbidity reports. So they're not included.
Okay, great, thank you. One other question was regarding the 8% positivity rate, if that was just referring to females, or does that refer to both males and females?
It referred to overall male and female at both schools. As Jackie mentioned earlier, the demographics and access to care, including STD care from School 1 to School 2 has differences, frankly, two separate, totally different socioeconomic areas. So within the school, one of the schools had an overall new STD diagnosis, which yielded a 5% positivity, and one of the schools yielded an overall new STD diagnosis of a 12% positivity.
Thank you. The next question asked, how does one get a copy of the 1 in 4 DVD that you referenced from the CDC?
I can certainly make that available. The very last slide contained my contact information, so I can be reached via the phone number as well as the email address listed on the very last slide.
Great. And also I'm getting a lot of questions regarding will these slides be available in addition to the recording when we send the recording out, because the recording will not just be audio, but it will be the visual portion as well. I can also send a copy of the slides in PDF format out to you guys, so I just want to clear that up. Okay, moving on to the next question. Oh, hold on just 1 second. Okay. One person asked, were students required to attend your event? If not, how did you reach out to get so many teens to attend? At our school-based clinic, we have trouble breaking the stigma that getting tested isn't the cool thing to do.
Before I turn it over to Ms. Brisland, and using the terminology school-based, we are not meaning to imply, I think it's worth being noted that we are not an integral part of the school, meaning we do not have an office or a clinic there specializing in STD. So when you say school-based, I think that you're referring to just any type of STD testing or presentations being done within the school.
The health science programs teach about STDs and HIV. Of course, it's covered in anatomy and physiology, and I think in biology it's all covered. The way we got buy-in is through advertising with the peer educators. I think once you give students the opportunity and the resources to get tested, you know, they want to do it. They want to know their facts. And it sure surprised us at School 1, the turnout, because we didn't know if people would be embarrassed to go and get tested. We certainly didn't know that it would be so cool to go out and do that. I mean, everybody was bringing their friends. Teachers were doing it, staff was doing it, and it was amazing. It was really amazing.
I'd like to interject a little bit. One advantage we had with these events was that it was a large consolidated effort, so there was no stigma attached to an isolated student going to get tested and what might be implied by that particular one or two students. Because it was such a galvanized effort, there was no isolation. I guess they had a certain amount of anonymity in testing because they were testing with a large group. And also those slides were very impactful. They showed, the presentation showed graphic representation of the STDs, diseases, exactly. And that may have motivated some of the students also.
And then the HIV positive speaker we had at the end, she was very, very powerful too. And that kind of brings it home with the students, you know, like, wow, this really can happen.
A real person.
Yeah, a real person talking about it and talking about what happened to her.
Okay.
Thank you for that answer. There are other questions. I'm going to go ahead since we're discussing the slide presentation. Someone was asking specifically what the slide presentation, I'm sorry, that you used with the young people, not the one that we're looking at right now. They were wondering, you guys referenced this in terms of what pictures they saw, but what other pictures were you allowed to present in the STD 101 part? And as a follow-up question to that, who are your peer educators and how were they selected?
Well, for the first part of the question, the pictures that were used are the ones available to the public from CDC through the Division of STD. If you log on to CDC Division of STD website, you will be able to locate STD pictures and you'll be able to tap in where you should be able to access them readily without difficulty. And they consisted of photos that show what happens when a person has chlamydia, gonorrhea, herpes, and other STDs. And as Jackie said, the pre-STD routine graphic pics.
And the HIV peer educators, they're a club that we've had at our school. Several high schools in Miami-Dade have them. We educate, these students sign up for the club and they get a 101 training on HIV and AIDS prevention. They go to an all-day training and they participate in presentations and see presentations, and then they have to pass an exam at the end, and they receive a certificate from the health department saying that they passed the 101 AIDS and HIV training. And then they participate in the school, AIDS Awareness Day, World AIDS Day. The kids like to hear that information from other students, not just from a teacher. So usually on HIV Awareness or AIDS Awareness Week, we do classroom presentations. And the kids have a script, and there's usually a team of 4 kids, and they present the HIV facts to different classrooms that the teachers request that they want the presentation. And it's overwhelming positive results that we get. The teachers love it, the students love it, and it's a great way to emphasize safety and prevention.
Great. And Joyce, there was a quick question to what you just said in terms of your peer club. Where do they meet, and do they need parental permission to participate?
Okay, we meet once a month, just like all the other clubs. We pick a day. We meet after school for usually an hour, and I mean they do all sorts of community service and projects. And no, they don't need parental permission. They just join the club. It costs $5 to join. And if they go on the field trip to learn about HIV prevention, of course the parents have to sign the field trip form, so the parents know. I'd say the parents are pretty positive in that way.
Did you share with us that some of the parents responded to you, that they were happy that this event took place? Yes,
the parents were thrilled. We're thrilled, and then they've asked every year since then, when's it going to happen again? The students have asked. Some parents have asked, the staff has asked, so hopefully we can do it soon sometime.
And let me just add, as Ms. Briswan is talking about the relationship building between students and teachers and administrators, we had something kind of unique, I would say, not isolated but unique to happen. One of the Miami-Dade County Health Department staff went out, when she was seeking or inquiring further about participating in this event, her child was a student at the school. So the child not only was a student but actually was an HIV peer educator. So we witnessed the student and the parent actually working alongside each other together. And we also had a couple of staff who commented, wow, I have a teen. So this is what happens at school, at a senior high school, you know, and they got a chance to probably have a refreshed mind in terms of, you know, the environment at home and the environment and communication and language that teens speak in their own comfortable environment.
And they earn community service points, too, by doing this. So they learn about the community and they learn about collaboration. It was just a win-win situation.
That's great. Thanks for reiterating the story about, you know, opening up a parent's eyes. I have two other sets of questions before I'd like to open up the lines. One is regarding, again, having to do with getting buy-in or pushback. I'm going to go ahead and ask several questions. One had to do with, now that you're expanding and doing work with different schools, are you receiving pushback from principals? How are they reacting to this in principals in other schools? Another person asked regarding, are you getting any pushback from the religious community? And finally, one person asked, how were parents notified of this particular screening event that you described here today?
Okay, I'm going to start answering that question, and I think the three of us have a little piece of that. But as far as getting buy-in from other schools, every school has its own culture, school culture, and the principal is ultimately responsible in Dade County, in our school district, for what happens on that school grounds. Of course, some schools are located in a more conservative area, and the principal may say, well, we would want the education piece, but maybe not the testing piece. Or, and Miami is multicultural also, so we always take into the culture of the school as well as the culture of the ethnic culture of the participants. Yes, we've had some pushback. It's not mandatory. This is something that's been offered up as this demonstration project. We identify schools where we did have progressive principals. So we were able to implement this. Subsequently, we've continued to partner with the health department, and we've done some testing in sites, at school sites where there is a high prevalence and the principals really want to help the students. Those areas where we will not be well received, we respect that and let them know that we have these services available. Want to talk about the religious pushback?
We had a little pushback on the religious issues. Nobody was forced to participate in any of this, and certainly if a child, wasn't comfortable, they could always go back and go do some research in another classroom or something. So nobody was forced. The couple of parents I did speak to, I just brought it back to safety, and this is really all about kids being safe, and that we respect everyone, and I thanked them for their input, and that's how I handled that topic.
Okay. I think we addressed that question.
You did, and then there was the final question in terms of how parents were notified of this screening event.
It's kind of incorporated.
Yeah. When the students take the human growth and development portion of health education, the parents, in our district, we have an opt-out policy, meaning that if you don't want your student to participate, you have the option to opt them out, and if you do not opt them out, then they're automatically in. And we send a parent notification letter home that discusses what will go on within the classroom in the human growth and development portion, as well as give them the opportunity to review curriculum. So as this was incorporated as part of their health education course.
Right.
Mm-hmm. So that was the notification.
Okay, great. And then the final sets of questions that I'm going to ask from chat before I open up the lines has to do with texting. So there were lots of questions on the chat regarding if you currently are using text messaging to provide individuals with their STD results, and if so, do you have a specific policy, a model policy, and if so, please share. That's more of a request on the end of those questions.
The Miami-Dade County Health Department currently does not have a policy. However, we're implementing a policy for STD results by texting, and we're following the lead of Clay County, Florida, who recently piloted and implemented this process of texting results. And we're hoping to soon have this approved in the Miami-Dade community because, again, this is the way teens communicate, and it not only serves the purpose of getting the information to the intended party timely, but it also saves a lot of time, as you would imagine, within our surveillance unit in not having to make the extra phone calls.
Great. Thank you for sharing. Now I'm going to go ahead and open up the lines. We ask for your cooperation. If you are not asking...
The conference has been unmuted.
If you are not asking a question, please press *6 to keep your line muted. That will reduce that. And if you are going to ask a question, you need, I unmuted everyone, but press *7 to unmute your phone. Okay. And so we're open for questions.
Yes, I have a question.
Please go ahead.
I'm Joan Payton. I'm Rural AIDS Coordinator in Portsmouth, Ohio. And I was just wondering, you mentioned in there about a progressive health program within the school. Has that been established for a while, or is that something that was established because of this program?
It's it's been in effect for a while. I really want to publicly acknowledge Joyce's work. She has worked tremendously. Those students at her particular school, they've made movies about HIV, STD prevention. They're really active in the community. They're just a really, really strong peer education group. Some schools have a club that's not as active. Her club was very active. But they have a more, of course, we have our state standards and our district policies and curriculum, but that particular school has always gone above and beyond in participation.
Thank you.
Mm-hmm.
Hello?
Yes, go ahead.
Hi, my name is Kira Smith. I'm calling from the New York City Department of Health, director of a Step Up program. It's a school-based education program that we have in the city, so we do go out into the public high schools here. My question was about the texting of results. I may have missed it earlier, but I wondered, will you be texting all results or positive as well, or would the positive message be to call someone? How would you be handling the positive results on texting?
That's a great question, and thanks for asking. And as we certainly know, in texting results, regardless of where you are in the United States working within a health department framework, there are certainly off-limits in information that you can and cannot share. We're following the pilot that's being conducted in Clay County, Florida, and they've been up and running for a few months now with some proven success. However, that's a smaller area, but providing us valuable information in terms of how we will proceed. Miami-Dade has not yet established the STD results by text, but we're looking into developing and hopefully being able to implement. So all of the particulars, if you will, are yet to be determined. But if you would, please look at the last slide where my name, Alessandria Killingsworth, and phone number and email address is listed, and shoot me a quick email or give me a call and we can discuss it more.
Okay, thank you. Thank you very much.
You're welcome.
Additional questions for the presenters?
I see one in the chat that discusses the April STD Awareness Month and what type of activities are conducted during that time. Through our school district, we recognize April, the month of April, as AIDS awareness, STD awareness, and what we do is we send out a district-wide notification that we want to concentrate on the curriculum during the last week of April traditionally, and we survey the teachers, the schools, as activities will be going on, the type of activities we've had. Research, we identify health resources, we identify speakers. There's been door contests, poetry contests, essay contests, Red Ribbon Day at the school.
We post the facts, like HIV or STD facts, over the announcements in the morning, just like little blips so the students can read them and maybe make them think a little. The door decoration contests are a lot of fun, and it really gets the whole school going and participating and reminding all the students to get tested or to be safe. And gosh, they get to wear their T-shirts that week. There's endless things that can be implemented in the school that week.
And I also saw another question regarding what age group were tested. All of our testing initiatives to this date have been conducted at the senior high school level. In Miami, that's 9th grade through 12th grade.
And for the specific to be sure, the average age was 17.
And ladies, I just wanted, I put the slide on your screening results. We had a request in the chat box. Someone wanted to view the slide again. And we also had a question in the chat box just now relevant to this. And the question is, how did you provide negative results to students? On one of the slides, there was something about a unique code provided. In other words, did students call the health department with their unique code, or did they log in or call an automated system with the code? How was the code used?
The students did call into the West Perrine STD clinic, staffed by persons who had all of the information they needed to make sure that they maintain the confidentiality of the students. At the time of registration, the students were asked key questions to include them providing us with a unique passcode. Additionally, they were informed of why they were being asked, and we asked them to make sure that they did not share that unique passcode with anyone. So when calling in to speak with a live person to find out what their test result was, and they were told on the spot in calling in if their test result for chlamydia or gonorrhea was negative or positive, they had to provide the West Perrine staff manning the phone with that unique passcode, as well as confirm some other questions being asked.
Thank you. We have 12 minutes left till the close. I have 2 more slides, closing slides at the end, but until then, if we have more questions for the presenters, please go ahead and ask.
Hello?
Yes, please go ahead.
Hi. Yes, hi. This is Judy Balmer. I'm calling from the Bureau of STD HIV Field Services in New York State. And I was just curious about how you handled medical record issues. I'm wondering whether or not you had medical records maintained at the Miami-Dade County Health Departments, and whether or not, this is kind of a second part, whether or not parents were actually inquiring about their child's test results, if that issue came up, and how you handled that.
Well, the medical records part was not a factor. We had the registration form. In Florida, if you are, and this is 2-part, in Florida, if a person is 13 and above, they can voluntarily consent for STD testing without parental permission. And in determining what the needs were for this project as it relates to permission being granted by whom, if it was already on file, we determined that the registration form, which had informed consent, as well as the piece I just spoke about with the confidentiality and the password piece, we did not have to utilize a medical record. And I think you had a second part to your question.
Oh, yes. It was whether or not parents were inquiring about their child's results, if that issue came up at all.
Didn't come up with me.
Did not?
No.
Oh, okay.
And I didn't get any feedback to that regard as well.
That's a good question.
No, at the district office either.
One calls the district office. If they didn't call the district office, that's a good sign. That's a good sign.
Okay, thank you very much.
You're welcome.
That's a good question.
Ladies, we had a question on the chat come up asking what steps were taken for positive students who did not call in for their results?
That is an absolutely fantastic question, which again allows me to say the name Disease Intervention Specialist, our highly qualified STD program staff who on a daily basis, their primary responsibility is to locate and refer persons who are known STD positive or contact to persons thus at risk for an STD. We had in place our existing STD prevention and control framework where, as most states or all, I would imagine, have required reporting, and the STD reporting is received by the local health department's STD surveillance program. And in that's just part of our routine where we go through the verification process and determine what the need of the individual is. And if we identify that a person is in need, for example, of chlamydia or gonorrhea treatment, we waste no time. We immediately go about the process with whatever information, locating information we have, whether it's the residential address only. And fortunately, most of the teams gave us correct locating information where we were able to reach over 90% of them. The disease intervention specialist, immediately upon receiving the positive lab, contacted the student, informed the student of the test result and where it is that they could seek treatment and access other STD services immediately. And as mentioned, fortunately, the West Verine STD clinic was located 3 miles from one school and only 6 miles from another school, and they did a tremendous job in not only notifying the students of their need to be treated or further examined, but especially doing it in such a timely fashion.
Thank you. And then we have time for one last question. If anyone has a question for the presenter, please hop on the line. Okay. I'm going to assume that everyone has asked all their questions. Thank you so much for participating in this webinar. Thank you, Joyce, Alessandria, Jackie, for presenting and practicing and taking time out of your hectic schedules to get prepared to present today. I really appreciate it. As we mentioned before, a link to the archive recording and the presentation slides will be sent to everyone who registered via email, probably through the ReadyTalk system, which you got the login information from. We'll do it through the same method. I also want to encourage you to complete an evaluation. I have the URL on the slide, but also when you close out of this window, once the webinar is finished, you will have the option you'll be taken directly to a SurveyMonkey evaluation, so please complete that. I will include the link with the archive recording as well, just in case. And finally, we ask that you save the date. We have another one of these wonderful webinars coming down the pike on Thursday, May 26th at 2 p.m. Eastern Time. We will be featuring speakers from Durango School District 9R and the San Juan Basin Health Department in Durango, Colorado. So those of you who indicated you wanted to hear of an example of school-based STD services in a rural jurisdiction, here's your chance. Please join us on May 26th, and more details to come. Thank you so much, and have a fantastic afternoon.
you. Please stand by.